Let's talk about the auditory brainstem response, or ABR, a fascinating diagnostic tool for understanding auditory and neurological health. ABR measures the electrical activity generated along the auditory pathway in response to sound stimuli. It's non-invasive and provides a detailed look at how sound signals are processed, from the ear to the brainstem. Now, let's get into the specifics of the ABR waves. These are critical markers that help us interpret the results of the test. There are 7 waves, but we'll focus on the first 5, which are the most clinically relevant. Wave I originates from the distal cochlear nerve, close to where it exits the cochlea. This wave reflects the earliest stage of neural response to sound. Wave 2 comes from the proximal cochlear nerve, near the brainstem. It represents the continuation of the auditory signal as it moves centrally. Wave 3 is generated by the cochlear nucleus, the first major processing station in the brainstem. Wave 4 arises from a combination of the superior olivary complex and the lateral lemniscus, 2 structures that help localize and process sound. Wave V, the most robust and clinically significant wave, is produced by the lateral lemniscus. It's the largest wave, often used to estimate hearing thresholds and assess brainstem integrity. So why is ABR so important? First, it's a go-to tool for neonatal hearing screenings, allowing us to identify hearing loss in newborns before it affects language development. In neurology, ABR helps diagnose conditions like acoustic neuromas, brainstem lesions, and multiple sclerosis. During surgeries, especially in the skull base or inner ear, ABR monitoring ensures the auditory nerve is not damaged. The beauty of ABR lies in its objectivity. It doesn't rely on a patient's active participation, making it ideal for infants, comatose patients, or anyone unable to provide behavioral responses. Clinicians can use it to estimate hearing thresholds, assess auditory nerve function, and pinpoint the location of any dysfunction along the pathway. In summary, ABR is an indispensable tool for diagnosing and managing auditory and neurological conditions. By understanding the significance of each wave and its clinical applications, we can appreciate the incredible insight this test offers. Truly, it's a cornerstone of modern audiology and neurology.